We did essentially foot, ankle, knee, hip, a little bit of lower back exam on you, but you had a lot of that collapsing of that foot and that arch on that side. So you pretty much overly pronate on that left side, right? That's collapsing of this foot, right? Typically with collapsing of the foot, if I show you this direction, typically when we collapse this foot, we will get internal rotation of the tibia and then external rotation sometimes of the knee, and then if we kind of pan out, we'll actually get internal rotation of the hip, external rotation of the knee, internal rotation of the tibia, as this kind of blends and kind of stomps down, right? That makes sense. So if we do it even with our elbow, we go this way, you see how this starts to internally rotate, but this starts to flail out, and then it starts to rotate the big joint over there, right?
Gotcha.
Even in this position, right? If you push like this direction, you see how you put pressure on the inside of the foot there, so to speak, and I'm going to call this the foot right now.
Okay.
Foot here. You start to internally rotate here. This elbow actually has to flare out.
I see what you're saying.
But then the actual major joint actually has to
come in,
open out.
Okay.
Right? But that's what's happening up in that hip. So you're actually having a little bit of a hip impingement up here and a tension of that hip through the front aspect here because of all the forces that are going up likely into that femur and the mechanical issues.
Okay.
Now, everybody's different. You just happen to be a little bit more like this, right? And so if we can strengthen a little bit of the outer here, a little bit of the glutes, you actually have decent strength through there.
Okay.
A little bit better than I expected. Actually, I thought you were going to actually fail those bunkie tests pretty badly. Now in terms of like overall strength, I think we can improve on that.
Right.
But I think that's everybody. But definitely more on that left side, because I think what's happening is like when you do that bunkie test, you feel that hip pain because you're naturally rotating that to do that, right?
Okay.
You're kind of like using these things over time because of the internal rotation of that femur. You're kind of like overly using these, and that's why you feel some of the groin pulling.
Gotcha.
So basically the adductors are the inside muscles basically that kind of help, and many of them, some of them are really stronger up higher. They actually pull the femur this direction. So if we have it like this, they pull them inward. So what's happening is that these are getting overused and pulling the femur this direction, which is pinching it up through that direction.
Okay.
Plus you're getting a little of that corkscrew movement of that internal
So
rotation.
a lot of this is it muscle related?
It's bone, joint, muscle, biomechanics.
Okay.
Yes, so yes.
Okay.
In terms of the foot, you actually, we talked a little bit about it. You're actually, when you do those calf raises, you should have some of that pressure going up through the middle of the foot. Yours is a little bit too lateral, which tells me you have slightly weaker I guess you could say intrinsic muscles of the foot. Basically, the muscles that are within the foot and that go down into the foot are weaker on this side and don't stabilize, which is more, you're kind of like smacking the bottom.
Yeah.
So if you're kind of doing this, you can't get this nice and strong, right? Try to palm a basketball, but do this to the front of your hand.
Gotcha.
That's kind of what you're doing.
Gotcha.
There are, of course, muscles on the inside of the leg that work a little bit harder, like the tibialis posterior. Now, here's the Achilles tendon. I'll show you that in a second. But we have some of the flexor that needs to be strengthened. And then we have the tibialis posterior, which actually attaches to the bottom of the foot and helps when it's tensed up. It zips this thing up, going upwards, right? And so it helps not only plantar flex or contract the foot, but you see where it kind of pulls up. It actually pulls upward on that navicular bone, which is right here. It would be like that bone kind of popping up and creating a nice arch, but when it zips up, it actually pulls up on the arch, right?
Okay.
So it kind of does this and kind of zips up and pulls up on the arch. But yours doesn't do that. It actually kind of does that. So we actually need to pull up on that arch a little bit better and get that muscle firing a little bit better. That will create a lot, how about this? shit ton of stability.
So you can
in
actually
your
help
foot.
the arch?
Yeah.
Oh,
yeah, yeah.
okay.
Mechanically, it takes some time, but
Yeah.
like, and I'm not saying you
I'm not
know.
gonna wake up tomorrow, but yeah.
That'd be cool. That'd be cool. But the difference between symptoms and no symptoms can be legitimately, you know, making a millimeter of that thing contract a little bit better, right?
Oh, wow.
I'm not saying you need to have a perfect arch support that's like this, but I am saying that if you constantly do this and corkscrew the hip, and now you're kind of like messing up the hip, but what if you just kind of did this instead of knocking like this, you went like this?
Right.
A little bit better.
That's
That might be the difference between you having hip pain and ankle pain.
Gotcha.
Because in your case, you're strong, but your calf is just working overtime because some of these foot stabilizers are not working properly.
Gotcha. Okay.
So if I go ahead and just Graston and ART and just work the hell out of the calf muscle and like, I think you'll feel some benefits, but I think we'll be chasing the symptoms.
Gotcha.
It would be like, again, I'm going to correlate everything in spreadsheets right now. Sorry to minimize your job, but it would be like, you know that one number that we didn't have the great equation to creating a whole wreak of havoc, or vice versa, fixing that one little formula
Gotcha.
could make the whole page look nice.
Gotcha.
Right?
Okay.
Small little tweak, big outcome.
Yeah.
Right. So I'm also a little spreadsheet geek, so
I can see that.
mostly for just one function, but that's it. But yeah, so I just try to always correlate something that you can actually relate.
Yeah.
But hopefully I'm not minimizing your job.
Not at all, man.
Try not to. But yeah, so we'll be working a little bit through the foot. In my opinion, grassing can help more of the calf in your case. I really like to be a little bit more specific with my hands, like the flexor. I would like to look more at the flexor hallucis and how to like really fire that a little bit better, working up through here. So basically, I'm going to work more with my hands. Getting into the hips, it's good to do some Graston, but it's really better, in my opinion, to get ART done or active release.
Oh, okay.
There's not one that's better than the other. I just am going to give you what I think is going to be best
Gotcha.
for your condition.
Okay.
Again, you can give me multiple advice.
Somebody just randomly told me about Graston, so that's I was like, oh, that should be what helps you. So it was actually some guy at the Joint Chiropractic.
Oh, cool.
There. So I was like, okay, I guess he used to do it, but he doesn't do it anymore because he's conflict of interest. So I'm like, that's when I started researching my Graston. And then
Yeah.
You came, you do all the stuff, so I'm like, perfect.
Yeah, so I do a lot of that stuff, but I think you're going to find that the hip problem is going to relieve itself a lot faster than the ankle and the
Okay.
foot problem. I think that the hip problem is as a combination of just everything that's happening.
Okay.
So there is some issues. There's no issues up in the hip that I've seen in terms of like labral tear or any cartilaginous defect or anything like that. But I do think that you're kind of like just twisting it and as a result, these ligaments right there and there are actually which is what we call the capsule, are kind of just like or
Okay.
just kind of tighten, and that's why you feel some of that tension.
So is a lot of it also from just sitting?
Probably some of it, but why wouldn't that side be an issue, right?
Yeah, true.
Like so. I think that you kind of have to correlate a little bit of what we did out there to
Okay.
like what's actually happening, and mechanically it makes sense.
Is the psoas? Is it? I don't know if I said that. Is that
Yep,
psoas?
psoas.
Is that what this is like? Does that also is part of that? Or is
Yeah.
that-
So the psoas muscle is a deep hip flexor muscle. In your case, you don't extend very well. Also, you have really tight quads. I think that's just more of your body style. I
Okay.
don't necessarily think that we can correlate that, but I do think that if we work the rectus femoris, which is also a muscle here, let me just show you something really cool that I'm going to geek out on you. Here's the iliacus and the psoas. They do attach to the front of the hip, and they do have fascial connections up to the hip flexor or to the actual hip joint itself. But let's get rid of that. You're also really tight into the rectus femoris, which is that quad muscle that I tested. If you see this branch, this is where it attaches to, but also it has a little branch, and it actually has a direct fascial integration or connection right into the ligaments here. So if we kind of like, so by us releasing and stretching some of this out for you, you're actually going to get a direct release of this capsule and these ligaments
Perfect.
as well.
Okay.
I didn't even realize this for a long period of time, how this anatomy situation works here. I mean, I understood the anatomy, but I didn't realize that this this program actually did that until recently. So it's really cool that they actually have that direct integration of like how it shows it like right off the bone.
Yeah, it's like a key detail.
Yeah, I didn't even realize that for a long time. So, but it really paints a good picture of like how releasing one muscle can actually directly affect the hip capsule itself.
Yeah, cool.
So we got a lot to work. I'm gonna work pretty quickly because we got a lot: foot, ankle, calf,
Sure.
hip,
Yeah.
yada yada yada.
Do your thing.
So yeah, that's what I'm gonna do.